it's half term, so there's a few people that couldn't get here today, so we wanted to record a session. I'm hoping everybody will be okay with that. So thank you. Jack, over to you.
Brilliant. Thank you, Yinka. So yeah, I put this first slide as more of an information dump, just so you've got the background of what's going on. I think the key point to take away here is that you guys, the pharmacists who've been delivering amazing service, have really excelled with the advanced service. So if you look there, a phenomenal amount of patients have been dealt with in the advanced service, 5 patients a day for the last 10 years. And when you start thinking about the absolutely staggering amount of change you've given to the patients' lives, I think this kind of service is a really great way to promote you guys to do better. Over the last couple of years, pharmacies really stood up with the COVID pandemic, and even just without the COVID pandemic, the growing mounting pressures that is in the NHS and healthcare. And I think you guys have absolutely sold yourselves, and you've shown the entire country how well you can do. And I think increasing the amount of service you can do and the with this pilot pathway is an absolutely amazing way of doing this. So what the national team developed was a pilot to include antidepressant medication in the current advanced service. So it's everything you've already been doing, but just with a slightly different medication. If you could go on to the next slide for me. I'm just aware we've already got time constraints, so I'm trying to get it down. So I think the key things to take away here is that what this is going to do is it's going to make your career path better. You're going to deliver more services. You're going to be able to have that more engaged time with your patients. And I think you're going to be able to reap the rewards of giving them this increased care, having that link with your patients. We know you're in the right position to do this, and we know that you're in the right mindset to do it. So we kind of want to give you this opportunity. We also want to help other local healthcare providers. Sorry. So we want to help other local healthcare providers, your GPs. They're suffering just as much as us. And I think it's another way of showing them how good we are. And we can work on those communications, those pathways between each other. And projects like this is going to influence future developments in pharmacy. So if you want to get your say in how things work, take part in the pilots, take part in the evaluation process of it, and tell us what's working and what's not working, because so that we can better, give you the opportunities in the future. Thank you, Yinka. So I know some of us aren't all from the Southeast, but if you're at all interested in delivering the service, so myself in the Southeast, we've got Deborah, who's in the East of England, and Eleanor in the Midlands, who are always happy. Our emails are just there, so please contact us if you ever want to get invested in any of these pilots. But yes, I will let you go over to the people you're actually here to listen to. So Dr. Simpson, I think you're next, aren't you?
Jack, we're always going to want to listen to you. So I'm going to sort of say if there's any questions, especially around the pilot, just please use the chat box function, which you'll probably see at the bottom of your screen, a little speech bubble if you don't know where that is. Use the chat box function. As Katie takes us through her presentation, again, if there's any questions, use the chat box function for time, and I will monitor that box if that's okay. Thank you, Katie. Just let me know when you want to change slides.
Oh, brilliant. Thank you. Yeah, I wasn't sure if I was sharing, but that's really helpful. Thank you. So yeah, thanks very much, everyone, for joining this evening. As I mentioned, my name is Katie Simpson. I've been in role now for 21 years. So initially it was the Windsor and the Ascot Maidenhead Primary Care Group, then the Primary Care Trust, then the East Berkshire CCG, then the Frimley CCG, and now finally I've sort of grown with it into the Frimley ICB, but it's effectively been the same role over sort of 21 years. And I have delivered this talk to GP trainees, to social prescribers, also the medicines management part is something that I deliver regularly at Reading University as well to our IAPT practitioners, so the PWPs who you'll be hearing about shortly, and the high intensity therapists as well. So I hope you'll find it helpful. If we don't have time to answer everyone's questions, then Yinka will email me and I'll make sure that because I do have to leave just before 8. So yeah, next slide please, that'd be great. Thanks, Yinka. So probably this might be a slightly unfamiliar diagram to you, but the step care model is something that is very familiar to those of us working in mental health. And what it means is matching the least intensive intervention to the patient. So what that means is obviously not everybody with depression needs to be admitted to Prospect Park, our local psychiatric hospital, or even be under the community mental health team. So what we are doing is trying to match the least invasive intervention to the patient, and therefore the most cost-effective intervention and the most appropriate and the most accessible with the shortest possible waits. So this is the introduction to it, and we'll be going back to this. So if I could have the next slide, because you can see step one is where myself as a GP, where our whole primary care team and yourselves would be sitting. And it's really important for us all to understand exactly what is available at that step one support before we even think about referring to talking therapies or writing prescription. So many of you will have heard of the social prescribing teams. Every practice in Frimley has social prescribers attached to them via the primary care networks. And they are specialists in terms of social intervention. So they will see people who are carers, for example, and provide support in terms of advice and services that are available to them. They can help with benefits. They can help with things like improving physical activity. They can improve people's social interactions and get people mixing. And sort of, we know how positive that is in terms of people's mental health, having your own tribe, having friendship groups. We know that social isolation and loneliness is really toxic. So if you have someone that you think could benefit from a social prescribing intervention, and they will also deal with things like frailty as well as mental health issues, as well as social isolation, they really will pretty much see anyone. They'll talk to families about sort of any social interventions that can happen. The patient just needs to ring up the GP surgery or send the GP surgery an email and say, I'd like to have a social prescriber appointment. So, you know, it's something they book directly. As well as the social prescribers in primary care, Berkshire Healthcare have something called a wellbeing service, which is quite similar to the social prescribing service. And that is their specialist specialist social prescribers, but they also have access to online digital support in modules such as how to manage your sleep, how to manage stress, and they also will offer sort of housing and finance support as well. In terms of further social support, some of you might have heard of the Friends in Need service that we set up several years ago. And this is a befriending charity that's currently run by Buckinghamshire Mind. It was initially set up by Depression Alliance, but passed to Bucks Mind about 7 or 8 years ago. And they basically organise social activities throughout the week across East Berkshire. And for example, they have walking groups, they have gardening groups, they have yoga and Tai Chi groups, they have arts and crafts groups, they have book groups. There really is sort of something for everyone. And you can find all their information on their website. And they're very much linked in with the social prescribers in the practice as well. We know how important sleep is to our brain health, to our mental health generally, and to our overall health as well, because poor sleep is linked to sort of, you know, very strongly linked to overall mortality, not just mental ill health. And we have, you know, as professionals, we do have access to be able to text or give out the NHS sleep hygiene advice, which is very useful. But equally, patients can directly access online support via Silver Cloud. And I would encourage you just to Google Berkshire Talking Therapies Silver Cloud. And then you'll see within that, there is all sorts of offers in terms of instant access support to things like sleep support, which I had terrible insomnia for 18 months. And the Silver Cloud package was the thing that cracked it for me. It really does work. But they also have managing anxiety and depression, direct access modules with no waits, managing perinatal mental health problems, managing stress. And that's something that patients can access themselves without needing to see a professional or a GP. But it is moderated by talking therapists. So within a week or so of them starting the package, a talking therapist will pick them up. So it's like a quick way into talking therapies. And then recently, the Frimley have commissioned on a 1-year pilot Sleepio as well. So I tried both Sleepio and Silver Cloud, and it's very individual. They do overlap, and there's a lot of similarities there. But as I say, and they're both effective. So you can actually tell the patient to just if they are living in the Frimley system, then they will have access to Sleepio as well. Of course, exercise is really important for our brain health and our mental health as well. And NICE actually recommends in its latest iteration exercise intervention for mild to moderate depression as an evidence-based intervention. So all of the GPs are linked into the exercise referral schemes at the local leisure centres across Frimley. As well as that, we have a charity called Sport in Mind that offers, because the exercise on prescription is subsidised, but patients do have to pay, whereas Sport in Mind offers free activity for all, and that can be for any sort of mental distress. So that could just be for people who are stressed, right up to sort of bipolar affective disorder, schizophrenia and psychosis, and anyone with depression and anxiety. And they run free badminton, free table tennis, free walking groups, five-a-side football, Tai Chi again. So if you look on the website, you can familiarise yourself with that and offer that out to your patients. I don't know whether you call them patients, customers or clients. Also, the Couch to 5K is brilliant, and the Active 10. So they're both NHS apps. Active 10 is a bit like it's a step counter that encourages patients and prompts them to sort of get their Active 10 in. And once they've completed the Couch to 5K, you might want to put them in the direction of the local park run, which is a brilliant way to meet people and get fit as well. Nutrition, of course, this is really important for good brain health, and that's where our social prescribers really come into their own with being able to advise on that and give more detailed support. But in effect, we're asking people to cut back on processed food, which we know is incredibly toxic to the brain. So it's real food, colourful food, naturally colourful food, reducing sugars, and having those healthy fats, nuts, seeds, olive oil, avocados and the like. In terms of smoking cessation, this is hugely important. Again, so toxic for brain health and really bad for people's mood. In fact, if you can encourage someone to stop smoking, it will have the same effect on their mood as taking fluoxetine or another SSRI. It's such a powerful thing, stopping smoking. And interestingly, people with psychosis can actually reduce their doses of antipsychotics when they stop smoking as well. So it's sort of win-win really. But these are all these holistic step one things that we should be sort of thinking about. And of course, across the patch, we've got smoke-free Berkshire, which is my area, but I think all of you in the other areas of Frimley will know your local smoking cessation services. Of course, encouraging sort of mindfulness meditation with the 1 month trial of Headspace and Calm is great. And then talking therapies do offer an intervention called Stress Less, which is for people who may be suffering from stress but don't have anxiety and depression. And they have online courses to help people manage stress better as well, which is accessible through their website. And finally, a new addition to the primary care workforce is our mental health Rs staff. So Rs is additional roles and responsibilities. It's to reduce primary care workload. So we have physios, pharmacists, and paramedics. And now we have mental health Rs staff working across some of our primary care networks. So at the moment, we have them in Windsor and Lock, which is Langley, Orchard, Sydenham and Chapel Medical Centres. And they are directly accessing, that's for GP receptionists to book patients directly into mental health nurses or mental health specialists for a mental health review. So we've got a lot at our sort of disposal at sort of step one before we even think, all those things that can have a really positive effect on brain health before we even go for thinking about what could be happening at step two. And step two is run by psychological wellbeing practitioners. So these are graduates who will have some previous mental health experience, who do the postgraduate course at Reading University or any of the other local universities. And at their disposal, they have a variety of options. So when people say to you, I've had talking therapies and it didn't work for me, actually, it's not a one-stop shop for everything. There's a whole variety, there's a menu of choices. So I think it's important for GPs, pharmacists, social prescribers, anybody working with people with mental health problems, to understand that, and to then be able to say, oh, you had the Silver Cloud online support. Well, that's one thing, but there's a whole load of other things out there. So it would be worth you going back to talking therapies. So as well as the supported Silver Cloud offer, these psychological wellbeing practitioners also offer guided self-help based on cognitive behavior therapy principles. They run workshops. They tend to do phone therapy, and the recovery rates are high. So people don't always like phone or video consultations. But actually, this step 2 seems to have the highest recovery rate, and higher than step 3, which is the one-to-one offer. And it's, you know, it's because people are seen quite quickly. The waiting time is less than 6 weeks. And obviously, the quicker we get people in, the faster they are likely to recover. And if they're not successful at this step 2, then they will get stepped up to step 3. So if we could have the next slide, Yinka. So step 3 is run by high intensity therapists and VABCP approved counsellors. And people who are presenting with really more severe anxiety, depression or phobias will go straight into step 3, but also people who haven't been cured by a step 2 intervention will potentially be stepped up to step 3 as well. And even in step 3, there's a variety of interventions. So someone might have had that one-to-one cognitive behaviour therapy for 10 to 12 weeks, and it might not have worked, but that doesn't mean that talking therapies isn't for them. There is one-to-one counselling for depression, only for depression actually. Counselling doesn't work for anxiety. It's not an evidence-based intervention. There's interpersonal therapy. There's couples therapy for depression, which isn't couples counselling, so that's not relate, but that's if someone's in a relationship, a non-abusive relationship, but in a relationship that is causing mental distress and aggravating their mental health, then they will do couples therapy for depression. But if they've got marital issues, then relate is the way to go. They also do eye movement desensitization reprocessing for trauma, which is a very effective intervention. And they have longer waits for this service. So this is running at about sort of 12 weeks. But patients, if they haven't already had the online Silver Cloud, will often be offered that to help them, to support them while they're on the waiting list. Something that people don't always know about is that talking therapies also have an employment advisory service, which is fantastic. So it will help to keep people in work in terms of their employment rights, and you know, supporting them to stay in work. It will also support people back into paid or voluntary work who maybe have been off work for a long time. And they'll also help people with sort of CV writing and interview skills as well. So it's a DWP sponsored scheme, but it is really effective at sort of maintaining employment and getting people back to work as well. Back to the step care model. So we've looked at step 1, which is obviously where we are all sitting, how we can work with step 2 and step 3. And a new service that's sitting at step 3.5, Yinka, if we could have the next slide, is called, in the north, is called MIX. In the south of Frimley, it's called GPIMS. And basically, this is a halfway point between primary care and talking therapies and our community mental health teams or our traditional secondary care services. And there is one you muted me. So I don't think I
sorry, Katie. Sorry, Katie.
Okay, I don't know where we got to. I was just saying there was one, there's one mixed team or GPIMS team per primary care network, so about 50,000 people, and they're comprised of a mental health practitioner, so a senior mental health nurse or social worker, a community connector who's like a specialist social prescriber. There is psychology support, pharmacy support and psychiatry support, and where this sits is it's non-urgent support for patients sitting between talking therapies and community mental health teams. So that commonly can be people with quite complex depression or complicated life circumstances. It could be people with emotional dysregulation issues, people with personality disorder or undiagnosed personality disorder, or it might be people with SMI, so that's psychosis, bipolar affective disorder or schizophrenia, who don't require the ongoing case management of community mental health teams, but do need a bit more support. They are a very effective team, and that team is accessed usually through primary care. But other organisations can refer as well. For example, our social prescribing team and other people within the mental health arena as well. And very often people will be stepped up if they've, if they turn out to be a bit too complicated for, for talking therapies, particularly if they've got very complicated social situations. Maybe they've got sort of comorbid substance misuse issues as well, where, perhaps primary care and or talking therapies isn't the right place to sort of manage these people. Could I get the next slide, please, Yinka? As well as the team that I've mentioned, the mix do have some additional services which I think are really beneficial. So they also have this service user network, which is a peer support group for people with complex emotional difficulties and personality disorders. And they meet 2 or 3 times a week. It's supported by a trained psychologist, and it's where people help to support each other and come up with solutions to their problems and have sort of like a moderated peer support, which can be really, really helpful for people who are in sort of chaotic and challenging lives. They also, as part of the mix, there's the Managing Emotions programme, which runs online psychoeducation for people who are experiencing emotional dysregulation issues. And then the final bit of this is that they also have senior psychologists running a PICT team, which is psychologically informed consultation skills and training. So they will support people who are working with challenging people, people with personality disorders, people where, the clinician is finding it really difficult to manage, and I'm sure that they would extend that offer to yourselves, if you were interested, if you were finding, setting boundaries and sort of, managing people with personality disorder really quite difficult. That would be an offer that would be open to you if you reach out to me at the end. Finally, I know we're going to be discussing about crisis support, but this is just a quick reminder that the Berkshire Crisis Team, that's the number to give out to people. They are a team of community psychiatric nurses and psychiatrists. They provide stabilisation in the community to try and avoid admission, and they are the gatekeepers to admission. So if people do need admission to secondary care, they will go through the crisis team, who will liaise with Prospect Park to get people into a psychiatric admission. Next slide, please. Some of you may know about this service, but some of you may not. As well as Berkshire Crisis Team, in the last year, we've had the Slough Safe Haven, which is run by a charity called Mental Health Matters. At the moment, it's running Thursday to Sunday from 5 to 11. People can actually access the service by ringing the mobile number listed there. They can email the email address, or they can pop in to 54 High Street, which is near Wetherspoons on Slough High Street, that Moon and Spoon. It's a brilliant service, and once patients or customers of yours have access to that service, they will have access to the Mental Health Matters crisis support line as well, which will then be open to them indefinitely. It's only open if people have accessed the service. And of course, you're going to be hearing about the Samaritans as well in due course. Now, Yinka asked me to just talk about children's mental health support. I know, obviously, this isn't really part of the pilot, but I thought it'd be important because you will be talking to families, you will be talking to, worried parents as well. So I thought it would be useful for you to understand the Thrive model, which is similar to the step care model. So where we have the step care model with adult mental health, we have the Thrive model with children's mental health, where in the middle we have the thriving child, which is what we're all aiming for. And around the outside, there is how to support a child with coping, how to support a child getting help, how to support getting more help, and then getting risk support as well. So if we could have the next slide, please. So in terms of coping, the sort of lower level support, that in our area, that's managed by Kooth, which is an online text chat counselling service. So they do text chat counselling, and they also have moderated chat boards as well, run by psychologists, where people can get advice and ask for help. And they have a lot of resources on there as well. It's open 12 till 10 p.m. weekdays and 6 to 10 at weekends. And that runs from age 11 to 25, recognising that actually the brain isn't fully developed till 25. And so it's one of the few services that does run across the sort of whole age group to 25. In terms of evidence-based websites that parents and children might want to access, I really recommend Minded, Young Mind and the Anna Freud website, all really good evidence-based interventions if people are worried about self-harm, worried about low mood, want to know more about neurodiversity, want to know more about depression, anxiety, bullying. There's all sorts of resources on there, and as I say, it is evidence-based. Also, Minded has some online programs for professionals to do some education and training as well, so well worth a look for yourselves as well. And if we look at the getting help, in terms of getting help, what's available to children and young people at the first level when they might need an intervention, this is now for sort of East Berkshire. We have our youth counselling, so in Royal Borough of Windsor and Maidenhead and Slough we have number 22, and in Bracknell Forest we have Youth Line. These are self-referral, and then we also have our getting help teams and our mental health support teams, so they offer like an early intervention for lower level anxiety, depression and mental health issues. The mental health support teams are based in schools, and we have one in Royal Borough of Windsor and Maidenhead, one in Bracknell Forest and two in Slough because of the higher need. And then in those areas where there are schools that aren't covered by the mental health support teams, we have the getting help teams offering a similar service. So this is evidence-based cognitive behaviour support with some behavioural support for people and for children who maybe are on the neurodiverse spectrum and maybe need a modified approach. And then we also have the Andy Clinic, which is linked to Reading University, which runs evidence-based interventions for children with anxiety and depression. Interestingly, up to 11 or 12, the intervention is parental. So that's the same for the getting help teams and the mental health support teams and the Andy teams. It's a parental approach, whereas from 11 or 12 plus, depending on the maturity of the child, the intervention is with the child. Next slide. In terms of getting more help, this would be where we'd have the traditional CAMS, so specialist CAMS, where we have the anxiety and depression pathway, the specialist community team for more complex children with behavioural issues, autism and ADHD diagnostic and support pathways, and then an all-age eating disorder service as well. Next slide, please. And then in terms of getting risk for children, where we're worried about them in terms of, if things seem to be escalating, we're worried about suicidal risk. The CAMS Rapid Response Service is currently running 8 till 10, Monday to Friday, and 8 to 5 at weekends. And there's a plan to expand that to be 24/7 later on. We'll have the Samaritans talking later, and the Papyrus are for, it's a similar service to Samaritans, but with a focus on sort of younger people, although they don't turn anyone away, but they are sort of advertising themselves as being for sort of younger people, 35 and under. Next, this is just when you have the slides, you'll see here about a summary of what the different mental health services are. And also a reminder that Talking Therapies is open to 17 plus in Berkshire. So anyone in the sixth form who's 17 plus can access that Silver Cloud support and access the adult Talking Therapist service as well. Next slide, please, Winker. And there we go. That's or just on this slide, just a reminder to you that we have the GEMS service, which has been set up to support parents and children and young people who are either on a waiting list for an autism assessment or an ADHD assessment, or have a diagnosis, so they don't need a diagnosis to access that support. And you'll be able to find that if you are working as an East Berkshire pharmacist, you can, if you Google GEMS East Berkshire, you'll be able to find all of the information to be able to give to your customers. Next, so we'll move on to questions at the end. So this part of the presentation is thinking about just a quick update in terms of medication advice. So we're going to run through this really quickly. As you, I'm sure, know, the NICE recommends when we are going to prescribe, and that's usually for the more severe end of the spectrum. So NICE is advocating social interventions like social prescribing, exercise interventions, and sort of more like psychological and talking therapist interventions for the mild to moderate, and suggests that medication is reserved for the more severe, unless the patient has chosen that approach. GPs will never say no, but we should be steering people away from medication to the other interventions where possible. But if patient chooses to go on medication, if they have sort of mild to moderate depression, we wouldn't say no. We need to prescribe generically to keep it cheap, because as you know, the branded SSRIs are still, pretty expensive. And we are to avoid using them routinely for sub-threshold depressive symptoms. And then when we are prescribing, we should really be discussing other options that I've mentioned, considering side effects, discontinuation phenomenon, interactions, their physical health, and previous experience. And in fact, it was the discontinuation that actually led to the delay in the new NICE guidance that came out last year, because discontinuation had not been considered as part of that guidance. And we know that it's a really important area, and something that you as pharmacists, I'm sure, will be involved with. Next slide, please, Yinka. So in terms of starting antidepressants, obviously, it might sound crazy to say that we want to get patients' agreement that they have a depressive illness, but very often in primary care, people will present with physical symptoms and may not actually realise that they do have depression. They may be presenting with other more physical presentation. We do need to address their sort of views and sort of myths on antidepressants. So, actually it is a gradual effect. It's not like an instant thing that you might experience with an analgesic or an antibiotic where it's a rapid onset of action. It's going to take at least a couple of weeks to start working, and potentially up to 4 weeks to see the full benefit. We will be talking about side effects in the next couple of slides, but we do want to warn them about not discontinuing abruptly, and that they may experience some withdrawal effects if they do stop suddenly. We do need to be asking about St. John's wort, because contrary to popular opinion, it's not a safe, benign medication. As you know, it interacts with the contraceptive pill and anticoagulants, and it's not made, it's a non-licensed medication, so it's the preparations will be different bioavailability from different sort of providers and different brands. So it's something that we are supposed to ask about and actively discourage for those reasons. In terms of review, we are supposed to review patients at 2 weeks after prescribing, and then at least monthly, unless they are a high suicide risk at presentation or they're under 25, in which case they should be reviewed at 1 week and then frequently. And then they'll be put onto repeat medication once they're stable. Next slide, please, Yinka. So this was many of you will, know that this is a rather oversimplified diagram in terms of how SSRIs are purported to work. The theory was that they were blocking the serotonin receptors at the synapse, thereby leaving more serotonin in the synapse to activate the other serotonin receptors. In fact, a study came out, Moncrief actually published a study in the summer last year that worked from University College London, seemingly disproving the serotonin hypothesis of depression. But nevertheless, we know that SSRIs do work. Now, many of us think it's too early to throw all of the serotonin hypothesis out the window, but it's true that actually it isn't the whole issue. And we know that SSRIs and many antidepressants increase neuroplasticity and increase neural growth and increase connectivity in the brain. And they're also quite potent anti-inflammatories. So it's probably that effect as much as, if not more than, the serotonin effects. And you may get people querying that if they've read that in a journal or in a newspaper or magazine article. But there's no doubt about it, they are effective medications. Next slide, please. Those common side effects tend to be gastrointestinal, nausea, diarrhea, headache, anxiety, tend to be, quite stimulating. So we usually take them in the morning, but I occasionally get someone saying it can cause, insomnia. So then we would say, so occasionally get someone saying it can cause drowsiness, in which case we'd adapt to taking at night time. Weight loss or weight gain, well, actually probably more weight gain, but it's not metabolically significant. It's not like an antipsychotic where people are going to put on several stone within a month or so. Probably, the patients will put on maybe 1 or 2 pounds. So it's not really enough to make a metabolic change, but some people do lose weight on them. These sexual difficulties can be really difficult. So that is a lack of orgasm in both men and women, and that side effect won't wear off. So if someone has got that side effect, we would need to swap them into a different class of drug. And we do need to be careful in people at risk of falls, so particularly the elderly. The SSRIs can lead, particularly in people who you know, are on other medications that are sodium depleting, like diuretics and the like, we can get low sodium and it can predispose them to falls. So in the elderly, we are encouraged to monitor people's sodium. Next slide. In terms of the effectiveness, they are all equally effective. We know that sertraline is safer in patients with long-term conditions because there's less interactions. Paroxetine does have more discontinuation symptoms, and GSK did hush up some safety data. So in primary care, we are encouraged not to prescribe paroxetine first line. And fluoxetine, although all of them can increase anxiety, fluoxetine seems to do it in more than the others, in about 10% of, so if someone's got a very mixed pattern of anxiety and depression, we probably wouldn't be prescribing fluoxetine, but they are all very effective. And you know, no differences between them. The SNRIs, we know that these also work similarly by increasing serotonin and noradrenaline, with that same caveat that that's not the be all and end all. We know that with venlafaxine, it's important to get that patients are getting their blood pressure monitored, and that would be important for you to ask, you know, are you monitoring your blood pressure, or have you had it checked at the surgery? But it's also more toxic in overdose, so we would prescribe smaller amounts, you know, if or ask a family member to look after it if someone is higher risk. And duloxetine is obviously also available as well, and for those other indications, with a similar side effect profile to SSRIs. Next slide, please, Yinka. Mirtazapine, I've just put this slide in because it just to sort of signify that it does work in a unique way by blocking the inhibitory alpha adrenergic receptors. It has some side effects which can be positive. If someone's lost a lot of weight and is struggling to eat, then the weight gain might be positive, but for many people that's a drawback that they won't want to tolerate. And the sedation can also be useful if someone's got a very sleep disrupted depressive picture. In terms of trazodone, this is a serotonin receptor agonist and a reuptake inhibitor. It is commonly used, although shouldn't be used in people with epilepsy. And in terms of side effects, fatigue, headaches, constipation and dry mouth can be a side effect. It can cause priapism, so that is sort of painful, permanent erections. And interestingly, in the States, it had been used as a treatment for low libido, because it can increase libido, but it can equally reduce libido as well. So it's a bit hit and miss. But again, that can have some sexual side effects. Vortioxetine, NICE would say that this can only be initiated after treatment failure with 2 other antidepressants. And it does modulate serotonin receptors, being an agonist of one receptor and an antagonist of another serotonin receptor, with an efficacy similar to the SSRIs and the SNRIs. However, when it was brought to market, it was shown to have an independent effect on cognitive function as well. Side effects are listed there, but in reality, the main one is nausea. I think it's quite a well-tolerated drug, and usually people tolerate it, and if they're going to get any side effects, it would be nausea. It's weight neutral and doesn't have those sexual side effects, so it's a good alternative. If someone has had sexual side effects, they've tried mirtazapine, they've not tolerated it, then vortioxetine would be a good third-line option. We know tricyclics are the gold standard. They are the most effective antidepressant. They still hold their own in randomized controlled trials against all the others. But they do have really unpleasant side effects, which you will know as pharmacists, even when they're prescribed at the 10 milligram dose as a sort of neuropathic painkiller. But in terms of the dose that's needed for depression, which is over 100 milligrams, you get these really unpleasant anticholinergic side effects. And of course, they're very toxic in overdose. And also over 50, I try to avoid them because of their potential increased risk of dementia, because of their anticholinergic effects as well. The sort of, they've got a high cholinergic burden. Next, and we should be avoiding dithiopin really. So if people are on dithiopin, I would be actively encouraging them to speak to their GP to be referred to be prescribed something else. And if the GP didn't feel confident, then they should be referring into secondary care to prescribe an alternative, because NICE is actively discouraging dithiopin. We'd be expecting them to see a response within 2 to 4 weeks. If at 4 weeks there's no response, then we'd say it was a treatment failure and we would offer something else. But if there's been perhaps a partial response, then at that point we can say, well, to the patient, would you prefer to have an increased dose but increased side effects, or would you prefer an alternative approach? And that's really very much for the patient to decide. Next slide, Yinka. I've mentioned about suicide risk, reviewing after 1 week, more forms of support, usually by sort of phone as well as face-to-face, involving the crisis team, and being aware that, as you know, antidepressants can increase anxiety and agitation, particularly in the first few weeks of use, and can thereby increase suicidal ideation. So that's why we recommend, you know, more frequent reviews, and particularly in under 25s as well. Next slide, please. NICE also talks about augmenting antidepressants. So potentially if someone is informed and prepared to accept the additional side effects, then NICE says that we could potentially augment the effect of the primary antidepressant with a second medication. So from a different class. So for example, we might use low-dose mirtazapine, trazodone, or venlafaxine, you know, at sort of 15 milligrams, you know, 50 milligrams and 37.5 respectively. Also, NICE says we can add a second generation antipsychotic to augment the effect of the primary antidepressant. And off-license uses in secondary care are things like triiodothyronine and lamotrigine as well, which we wouldn't be doing in primary care necessarily. Next slide, please. In terms of relapse prevention, it's important that if people do go down the pharma route, that they continue treatment for at least 6 months from recovery. Some people might need to continue it for more than 2 years. For example, if they've had 2 or more recent episodes of depression, or they have other risk factors, or the relapse consequences would be severe. And here in this one, airline pilots are often cited. But many people, obviously, their job is their livelihood, and they may decide for sort of occupational reasons to, you know, to minimise the risk of relapse and take longer. However, there's also psychological approaches that have been proven to reduce relapse prevention. So individual cognitive behaviour therapy, or when someone has recovered, the group mindfulness-based cognitive therapy approaches, which all of the NHS Talking Therapies services offer, is also really evidence-based at relapse prevention. Next slide, please. With discontinuation, we normally reduce over a 4-week period, but some drugs do take longer. For example, people taking paroxetine and venlafaxine, we would usually do that over an 8-week period. The exception is fluoxetine and vortioxetine, which do have longer half-lives. And although NICE does talk about, you know, making dosage reductions, many people who are on fluoxetine and vortioxetine who stop don't experience those withdrawal phenomena that, you know, on the other drugs that they would potentially experience, which some people can actually think is a relapse, but actually it is just withdrawal phenomenon. So they may have similar symptoms, they may have anxiety, they may have some of the gastrointestinal symptoms that they had at the beginning. So we usually warn people about discontinuation symptoms that they usually settle within a week, and usually they're mild, and people can be just reassured and monitored. But if the symptoms are severe, then we would go back to the original dose and do a more gradual dosage reduction, or potentially we might reintroduce a drug with a longer half-life like fluoxetine that we can then wean more slowly. Next slide, please, Yinka. This slide is just showing about the efficacy and tolerability of antidepressants. So this was a meta-analysis that came out, Cipriani, in 2018. And on the left side, you'll see the efficacy. So you'll see that amitriptyline is still coming up as the most efficacious. They are all over the confidence interval of 1. So that means they are all more effective than placebo, and they are all effective. However, something will not be an effective antidepressant if it's not tolerated. So on the right, we have the tolerability as well. And interestingly, aglamellatine, which is red in our formulary because it requires liver function test monitoring. So, but that one was deemed to be the most tolerable, with fluoxetine coming in as second. So it's a balance of effectiveness and tolerability. But as I say, I think we can reassure ourselves that they are all, you know, efficacious. Next slide. In terms of antidepressants in pregnancy, about 3 to 10% of pregnant women will be on antidepressants, you know, when they fall pregnant, and the majority of them will stop these antidepressants when they're pregnant. But we do know that if they stop, they have a very high relapse rate of 68% versus 26% if they continue the medication, and it's increased if there've been several past episodes as well. Next slide, please. People are often very worried about antidepressants in pregnancy. And of course, you know, talking therapies is the safest option, or exercise, you know, keeping physically active, eating well, sleeping well. Having said that, you know, the evidence is conflicting, but we do know that it is a small absolute risk. We know that the likelihood is it's the co-founding variables, that people who have depression in pregnancy are more likely to smoke, to drink, to make unhealthy life choices, and you know, be in financially sort of challenged circumstances. So it's likely that it's the co-founding variables. We know that children born to women on SSRIs can develop neonatal adaptability syndrome, which causes poor feeding and irritability. But that only causes a reduction in the APGAR score of 0.3 on average. The APGAR score is scored out of 10, and this is usually sort of mild and self-limiting. If people are wanting to stop, then I would always be making sure that they have access to talking therapies and they know about the other support that's available out there. In terms of what's recommended, it's to avoid paroxetine, but the evidence isn't strong. Sertraline seems to result in the least placental exposure and the least breast milk exposure. So, you know, if we were going to prescribe, we'd be sort of thinking about sort of offering sertraline. One thing we would say is we would never give subtherapeutic doses. So we would never say give 25 milligrams of sertraline or, you know, 10 milligrams of fluoxetine, because that's the worst of all possible worlds. You're exposing the baby to a drug that's not going to be effective, and thereby, you know, as I say, so we definitely aren't encouraging subtherapeutic drug prescribing. It's full dose or no dose, but certainly not combination therapies. So in terms of, you know, it's, you know, when we're assessing depression, we expect GPs to understand the step care model, that GPs should be involved throughout the management process, even when patients are under talking therapies, that GPs and, I say, community pharmacists, I think, should have a knowledge of sleep support, sort of lifestyle interventions, exercise interventions, smoking cessation, dietary approaches, and also, you know, an awareness of our local alcohol support services as well, because obviously there is a real overlap with substance misuse and mental health. Hopefully you have a bit of a flavour now about what's available in terms of talking therapies at step 2 and step 3, and that there's a whole menu of interventions. So if patients say it hasn't worked for them, do encourage them to sort of go back. That we tailor the pharmacological treatment choices to the patient, and that we counsel against using St John's wort. And I think that's it, Yinka. Thank you. So sorry to have to rush through it. There was a lot to cover. I don't know if we've got any questions in chat or if anybody wants to ask anything.
Thank you so much for that, Katie. Really informative. And I'm hoping everybody in the room has found that really informative. And I know there's lots of people that want the recording as well and the slides. So thank you for agreeing to share the slides. Are there any questions for anybody? Because Katie does need to leave us now. So if there are no questions, or if you think of a question, please feel free to use the chat box. I will collate them and Katie, I'll get them to you. But yeah. Can I just say thank you very much for your time, Katie? And I'll let you go. I know you're super busy and you need to leave, but we appreciate you. Thank you, Katie.
Thank you. And as I say, don't worry, do ask Yinka if you think of anything. You know, Yinka's got my email, and you know, I'm certainly happy to answer any queries you might have. I work at Dedworth Medical Centre as well, for those of you that are working in the Windsor area. Yeah. Fantastic.
Thank you. Take care. Bye-bye.
Bye-bye.
Lovely. I hope that was informative, guys. There's lots of thank yous in the chat box for you, Katie. What we're going to do now, Shilpa, if you don't mind, I'll share the slides, and I've got them ready for you. But again, any questions, please feel free to use the chat box function. We will endeavour to get a response to you. So we are very fortunate to be joined today by Shilpa Shah, who, Shilpa, I'll let you explain your role in the Samaritans and take us through your presentation, but thank you for your time.
Thank you, Yinka. My name's Shilpa, as I said earlier, and I'm a CEO for North East London LPC, and I'm a community pharmacist, or my background is community pharmacy. But I've been a listening volunteer for nearly 8 years, at Samaritans now. There was no main reason that I got into this. I was looking back, 8.5 years ago to volunteer locally because I really wanted to give back, and so I just typed in where to volunteer, and Samaritans came up. But actually over the last 8 years I've seen a real synergy between mental health that's on the increase and what we see in community pharmacy, because as we know, Katie went through some amazing organisations that can help with mental health, but we still know that people aren't always getting the help they need, and they're coming into pharmacy, and we're seeing more and more people that need our help. So I've seen a real synergy between some of the skills I've learned at Samaritans. So if we could just go to the next slide, please, Yinka. So I'm just going to go through a few top tips for you when you're talking to your patients. So if you're doing NMS, or if you are just talking to them about some medication that they're on, or you come in, you see a patient that maybe doesn't look, you know, I think that's the beauty of community pharmacy, that we get a real holistic view of a patient. So you may know something about them that they haven't told any other healthcare professionals. You might have somebody who is coming in buying medication to vitamins to help them become pregnant, and it's causing a lot of concern that they can't, which it ends up causing mental health issues. Or you may get somebody who's lost a loved one. You may just see people that are quite lonely. You know, so in community pharmacy, we see people all the time. But Samaritans is really, really big on listening. The one thing I'll tell you about Samaritans, which is different to community pharmacy, is that Samaritans don't give advice. So we listen, we ask questions, and we help people, I suppose, unjuggle and unmuddle those thoughts that might be flying around in their head, so that they can make their own decision, and they're more engaged in that decision that they make because they've come to the conclusion themselves. Now, there's a big difference in community pharmacy. As healthcare professionals, our job is to give advice. So that's just something I want you to bear in mind, that there are two big differences. But it's really important that when someone comes in asking for help, or if you feel that that's someone that needs your help, that you show care. This one's a difficult one. Have patience. And the reason I say this is difficult is because you may see someone that doesn't act how they normally do. They're normally quite bubbly and cheery when they come in, but you notice they're a bit down. They may not open up to you straight away. It may be that they come in every week, or they come in monthly for their medication. It may be 2 months, 3 months down the line when, you know, they decide to talk to you. But the other part of the having patience as well is, you know, we know how busy we're getting in community pharmacy and how everybody wants a minute of us. So you're talking to a patient, but somebody's calling you because the phone's ringing, or somebody needs advice over the counter. And I think when we're talking to people with any condition, not just mental health, patience is really important in giving people that time. So we're so lucky we have private consultation rooms. It's really important that we use them so people feel comfortable, and that we say to people, take your time. I know that may be really hard because you're thinking, well, you're taking your time, I've got a million things that I need to be doing. But in the long run, you're going to get much better, I suppose, engagement from that person if they're just given the time to be free to say what they need to say. Open questions are really important as well. We all know as community pharmacy the skill of using open questions rather than closed questions. So questions where they have to reply with more than just one word. So, you know, do try and use open questions whenever you can. And obviously, again, we know this in community pharmacy. It's a skill that we're taught early on when we're talking to our patients and customers around saying it back. So almost paraphrasing, repeating back what they've said to you, just to clarify and to make sure that you've got the right information. And this one's really important, have courage. So I think we're all a bit scared, or you know, definitely I was before I became a listening volunteer at Samaritans, of talking openly about suicide. I think that we think if we say to somebody, are you feeling suicidal? Are you having suicidal thoughts? That we're somehow going to put this idea into their head. But actually, if somebody is feeling suicidal, if somebody's having suicidal thoughts, it's not going to be us asking the question that suddenly make them feel that way. Or it's not, somebody's not going to say, oh, I wasn't really thinking about suicide, but now you mention it, that's definitely something I'm going to think about doing. You know, it's I suppose making it less taboo, and, you know, really being able to talk about it confidently, in a manner where we're not hiding away from it, and we're making it, or normalizing talking about these difficult conversations that we often are afraid to talk about. So I think those little top tips are really important. Could we have the next slide, please, Yinka? So we talked about open questions. I think a really important one with this, especially with the NMS service that you guys are offering in your area on the pilot, is you've been prescribed this new medication. Can you help me understand what you're taking it for? So rather than saying, oh, you're on this antidepressant for this, you know, you're almost, I suppose, prejudging what that patient is taking that medication for. And I think what we really want to ascertain from the patient is, you know, why do they think they're taking the medication? Do they feel that the reason they went to the GP and the medication they've given, does that match up quite clearly? I think asking questions about how are you feeling? So that's not saying, are you feeling down? Are you feeling depressed? Are you feeling lonely? How are you feeling? So really giving them the opportunity to just pause and think about how they're feeling. As I said here, don't be afraid to pause and be silent. So what you'll notice is when it's a skill that we learn in Samaritans is sometimes about being silent. And maybe this is something you could try with your friends or family, maybe at the weekend. Ask a question and just be silent and wait for the answer. And the reason I say this is that in a conversation, especially sometimes when it's people you don't know, it's a bit different if it's people you know, we're all afraid of silence. We all want to fill that silence. And in this situation, make sure it's the patient that's filling the silence and not yourself as a pharmacist. And the reason I say that is that they're more likely to then open up and be able to talk about whatever they want to talk about without you jumping in with lots of questions or trying to fill the space. And then I suppose the other question that might be important is, what are you hoping for from taking this medication? And I suppose the reason I would suggest that in this situation you ask that question is because if they're hoping that, you know, they'll feel better overnight, I guess, you know, it's about explaining to them that, you know, it's going to take time to work and what the side effects may be and how they may need to persevere, or in some situations, like what Katie said, they may need to switch medication. So it's always good to know what they want from the medication without, again, us assuming that they just want to feel happy from tomorrow. They may just say with an antidepressant, they just want to feel as though they can, you know, get themselves out of bed in the morning and go to work. That's not the same as saying, I want to be all happy and cheery and you know, go out with all my friends socializing, etc. So what we think people want may be different to what they actually want. Next slide, please, Vinka. Thank you. I think signposting is really important. I think what was really useful around Katie's presentation earlier, just before mine, is that there are so many organizations out there, and it's really important that any services that we offer to our customers and patients, we realize that we should be signposting if we don't have the answer, because we are not experts in everything. We're experts on medication, but we're not always experts on emotional feelings and dealing with those and really getting the best from our patients. So making sure that there are other organizations that can help support the patient with their mental health. What I will say is that every area is different, and make sure you are familiar with the websites and you look at which in your particular area, what services are available. And also sometimes it's important to know the time lag on these services. So you could recommend that someone uses talking therapies, but if there's a 6-month time lag, I think it's really important to try and be able to give that information to your patients so they're aware that it's not, again, a quick fix. And I think the other thing always to think about as well is sometimes I think pharmacists in particular, we're quite solution focused and we just want to help that person get better very quickly. And we may end up signposting to 2 or 3 organizations. And I think we've got to realize that that can be a bit overwhelming for people with depression or mental health issues. And we need to really make sure that we're not forcing lots of different organizations onto them and that we're really trying to find the right one for them. And actually, they may have tried it before and it didn't work. So it's just about taking that step back and using the listening that Samaritans use. And then we can do questions at the end, Yinka, but if you want to go to the next slide and then the one after, please.
Is that okay? Brilliant. But yeah, but if there's any questions, please do feel free to use the chat box.
Not the next slide, but the one after. That one's just got some information on. So with Samaritans, there's different ways of contacting Samaritans. The most popular way is people phoning. So the phone number is 116 123. It's a free number. It's fully confidential. Calls are not traced, they're not recorded, and you go through to a call centre. There's 200 branches across the UK, so it could be picked up by anybody, and you can call if you call you speak to someone, you feel a bit better, you put the phone down, but then 4 hours later, you're not feeling so great again, you can call again. For people, and I find that younger people tend to use this a little bit more. We also have an email service, which is joe@samaritans.org. And there is a 24 to 48 hour wait on responses for emails. So you could email, you won't get a response immediately. With the phone call, it should get picked up within a minute or so. Obviously, it varies throughout the day at the different times. And some people also use like a letter writing service. So you can write a letter to Samaritans, and within 2 weeks you'll get a response in a letter form as well. And then there's like I said, 200 branches as well, so there may be a branch near you, and some of our branches have started post-COVID offering face-to-face visits again. We don't have a lot of people face-to-face, but I think that's because people don't know that we offer that service, so that's just something worth pointing out as well. Thank you. Brilliant. And oh,
Just saying, I'm just conscious that we're moving now into the session where it's about how you look after you. So I hope you can kind of recognize that what we have shared. So Katie, Shilpa, thank you for your presentation as well. There's that bit around how do we support our patient, the tools, the resources. Now, what about us? So Shilpa, you're going to share with us, aren't you, what we can do to look after our mental well-being as well. Thank you, Shilpa. I just thought I'd share
that. So I think what's really important, not just with this service, but just with community pharmacy, we know that the last couple of years through COVID have been really tough, and we know that we've got lots of funding concerns in community pharmacy, which is putting a lot of pressure on us and your teams as well. So I think it's really important that you do take some time to look after yourself. You're there constantly for your patients, but it's important that you know, you do take that time to look after yourself as well. So not a lot of people know exactly what pharmacist support does, but pharmacist support, can we go to the next slide, is an organisation that has been created or established by the RPS or RPSGB, as it was back in the day, but in 1841. So it's an organisation that's been here for years, and they provide support services for pharmacists, pharmacy students and trainees. And they provide wellbeing information and resources for all the pharmacy team. And there's a website that you can visit. Now, they are doing some work to see what they can do to support technicians, registered technicians, but unfortunately at the moment it is only open to pharmacists, pharmacy students and trainees. But what has happened in the last few years is that they've really revamped their website. They're doing a lot more external work to kind of show people what they're about. And I think that, you know, as pharmacists, you know, if we feel that we need to use them, we really should, because they are there for us, and we want the organisation to continue running. Next slide, please. So they have free confidential services, so you can get the information and inquiries from them. They have financial assistance. So, you know, if you're going through any difficulties, you can talk to them and they can advise you and help you on that. They have a counselling and peer support service. So if you contact them by either email or through the website, they've got like a form that you can fill out, or a phone call. You talk to someone and they can decide whether you need some counselling. They've got specialist advice. They use a wellbeing service. And also what we're noticing more and more, unfortunately, over the last couple of years is addiction support is really needed, as unfortunately, I suppose, as things are getting tougher for pharmacists working out there, that they may be using substances as a bit of a crutch to help them get through, and then that gets a bit out of control. And I think it's really important to note that it is a confidential service, so you don't have to give your real name if you don't want to. But it's really clear that, you know, you won't be reported to the GPHC if you phone up and you're asking for help. You know, pharmacy support is there to help you and to get you the support you need without the fear of you being reported into GPHC. Next slide, please. Pharmacist support also have a campaign which they're really trying to get out there. So for any of you that are on any social media, Twitter, LinkedIn, any of those, and you want to tag pharmacist support into anything, if you're doing any work with community pharmacists on mental health, #ActNow is the hashtag that they're using. Next slide, please. So this is what the front page of their website looks like. And as you see, you can go to their website and look at kind of, get help on managing physical health, finances, etc. And then they've got all these sort of different areas that you can look at on the website. And I think that's really important that you just, we're all really busy. Nobody has time to do this, but I would love if after you got off this call, you just spent 2 minutes. We're always scrolling on our phone in the evening while watching telly. So maybe scroll on the pharmacist support website and see if there's anything out there for you, or for pharmacists that work for your organization, or for locums that you know, or friends of yours that are pharmacists that are struggling. I think it's really important to teach all our trainee pharmacists that we have about this service, so they know it from trainee pharmacy onwards, that organization is always there. And we do know that trainee pharmacists are often contacting pharmacist support at the moment because they are feeling the pressure of working in not only busy community pharmacists that are busy and have a lot going on, but also that, they've got the pressure of the exam, and I think they've got their exam in a few weeks' time. So this is a really stressful, tough time for them. So, for any of you out there that have got trainee pharmacists working for you, about to take some time off to study for the exams, do just let them know about this website, just in case they need that kind of support over the next few weeks in particular as well. The website also takes you to a wellbeing learning platform. And I think one of the things that I would really say, again, it's about making time. Don't think of pharmacist support as the people that are there for you when you're going through crisis, whilst they absolutely are, a bit like Samaritans. What both Samaritans and pharmacist support want to do is get you to a point where you're not having to ring up because you're in crisis, because you've tried to help yourself along the way. So basically, by using their wellbeing learning platform, doing a few modules, putting in a few daily practices or weekly practices that help your wellbeing, hopefully that will stop you getting to the point where you're absolutely desperate and needing to ring any of these organizations. So again, going back to Samaritans, if you've had a really bad day at work, or you are going through financial struggles, while Samaritans can't give you advice, by ringing them up and talking to them early on, it stops you getting to that point where you're ringing them up because you're absolutely desperate and you feel that you've got no other option or which way to turn. So please, start thinking about using your well-being, looking after your well-being, all the time. Now, I kind of struggled with this one because I know we hear the word resilience quite a lot in community pharmacy, and I think sometimes we expect people to be resilient when things are so tough at the moment that even the most resilient people out there wouldn't be able to cope with what's going on. But I think, when I actually went through these slides and looked at kind of the definition, I suppose it gave me kind of a different viewpoint on what resilience is. So just a quick question for anyone out there. Does anyone know what resilience is? I mean, put it in the chat, a quick hand up if anybody kind of has an idea of what their definition of resilience is. No, not to worry. Let's go on to the next slide and I'll tell you. So, resilience is the ability of a substance or object to spring back into shape, elasticity, and resilience is the capacity to recover quickly from difficulties and toughness. I think in community pharmacy at the moment, we are going through so many different difficulties. There's so many things happening that you are constantly recovering and then maybe having to go through something else that you need to recover from, which is why looking after your well-being all the time is important, and not just thinking, oh, well, I bounced back from that last week, or I've bounced back from that situation, I'll be fine, I'll bounce back from it, because one day maybe it will be difficult to bounce back. So just do have a little think about that. And next slide, please. So resilience is about the ability to bounce back from adversity. It's to come through something difficult in a positive way and to learn and grow. And it's about adapting to challenge. So at the moment, we know, as we said, we've got so many different challenges. But I think what's really important as well is making sure that if you do get through something difficult, that you do share. You share with other people what you've been through and how you came out of it on the other side. Because I think one of the things that people find really difficult is feeling that they're the only one going through a really tough time, or that they feel really lonely with their situation. But actually hearing that other people are in the same boat, whilst it might not make your situation better at the time, it is just a bit reassuring that, you're not alone in what you're going through. Next slide, please, Inka. Thank you. There's a famous Charles Darwin quote, which actually I think I've been quoting it wrong all this time. But the quote is, it's not the strongest of the species that survive, nor the most intelligent, but rather the ones that are most adaptable to change. Something I always say in community pharmacy, we have gone through more change in the last 2 years than we have in the 22 years before that. But I feel like I'm saying it all the time. We're constantly changing. I think before, when I first qualified, we just dispensed items. We didn't have MURs, we didn't have NMS, we didn't have flu vaccinations, and it was a really steady ship that we were sailing, I suppose. And now it just feels that there's turbulent waters. It's getting a bit tougher. Something's changing all the time, and we really need to learn to adapt to that change to keep up, because there is a lot going on. So it's just something to think about. If you are somebody that finds it difficult to adapt to change, what kind of things can you put in place to help yourself adapt better? Or if your team find it difficult to adapt, that can put a lot of pressure on you as the owner or as the pharmacist. So how can we help them? How can you engage them? How can you win hearts and minds so that they start adapting a bit better as well when there's some change? Next slide, please. So what are the characteristics of people with high levels of resilience? There are more characteristics than this. There's a few named here, but there's lots of different ways that people, deal with resilience and become resilient. So it's accepting yourselves for who you are. So if you know that you're somebody that gets really stressed out when you're busy at work, we can put lots of measures into place. But if that's the way you are, sometimes it is accepting, this is the way I am. I just need to work through it and do what you need to do. For me, I love being busy. I often don't say no to any opportunities that come my way, even though I know that I really should say no to make time for myself. But I've accepted that that's just the way I am. So I've just learned to adapt myself to sort of say, right, Shilpa, you are going to say yes to everything because that's just what you do. But make sure that you've got measures in place. You've got lists that you follow. You've got routines that you follow, that you make sure that you've got time planned in with friends and family. Volunteering is really important to me. So, making sure that I do have time for my Samaritan shift every week, because I get to meet different people and help people, etc. Understand that sometimes life can be tough. So there's always going to be times that you go through that are a bit tough. I think what you need to also recognize is if every day feels tough, then, how can you get yourself some help and support with that? Learning from difficult experiences. This goes back to what I was saying. Please don't feel afraid to share some of these difficult experiences with your colleagues, with friends, because what you'll find is that other people, whilst their experience may not be the same, they will have examples of things that they've gone through. Make realistic plans. So again, I go back to myself. I'm a real list maker, but I definitely put way too many things on my list to what I'm going to get done that day. And then I always feel disappointed when I don't. So actually, it's only been in the last couple of years that I've started putting 3 things on my list. 1 big thing that I definitely want to get done, 1 medium thing that I want to get done, and 1 small thing that I want to get done. And I make it more manageable for myself. So if I do anything on top of that, I feel like amazing because I've done more than what was on my list initially. Believe that you're in control of your lives. At the end of the day, you are in control of your life. Nobody else is. You're the one that's in control of your life. And if you feel that you go through a tough time or you need that help, only you are the person that can pick up the phone, go on the internet, have a look at what you need, talk to other people, etc. Put in a place of a network of support. So sometimes when we're going through tough times, we tend to close ourselves off. We tend to go into ourselves a bit and maybe don't reach out for that help. But you'll be surprised at how many people noticed, but maybe didn't say something. So when you do eventually ask for that help, your friends might say, well, I did notice you were a bit quieter than normal, or you've not been so active on the group WhatsApp, etc. So I was wondering if everything was okay. And remember that you're friends with people for a reason, or people care about you. The people that work with you, they care about you. They want you to be happy and to be safe, I guess, and you want the same for them. So don't feel that there's any shame in asking for help. Do value your achievements, big or small. So sometimes it's just, I went outside for 10 minutes to get a bit of sun in my really busy work schedule, and actually that might seem like such a tiny thing because you see loads of other people out there for hours at a time. But if that's something you don't normally do, but you know that you've done that for yourself, then that's a massive achievement. And people with high levels of resilience, they see themselves as fighters, not victims. So I think it's really important to recognize that, you know, you will get through it, and when you do, you'll come out stronger, as people say. But that's not to say that everything needs to be a battle. You don't need to fight with everything. Sometimes, you know, sometimes you just need to say, this isn't right for me, and be able to move away and walk away from that. Next slide, please, Inga. Thank you. So sometimes you need to accept that you can't do everything, but everything you can do will be a great help to someone else. So we know what it's like in a busy pharmacy. You've got 10 people waiting in the queue, you've got the phone ringing, you've turned up that day maybe as a relief in a pharmacy or a locum, and sometimes it's just about sitting down, prioritizing your workload. You might not be able to do everything that day, but remember, whatever you do has made a difference to someone's life. And I think we forget, especially in the job for you guys that are on the front line every single day, I think you forget that every patient, even just handing out medication to someone, that medication is generally given to someone because it's life-saving, or they need it to lead a reasonable life. And that's huge for that person. For you, it might feel like one of your hundreds of patients that you have coming in, but actually for them, it's huge. So don't belittle the job that you do. Next slide, please. Food and sleep is really important, making sure that you're eating as healthily as you can. That's probably something I don't do very well. And sleep is very important as well. One of the things I wanted to highlight to everybody, there's an app on, I think you can get it on any Apple or Spotify. It's called Calm. And at the moment, if you have an NHS net address, you can get a blue light card, and it's 50% off, so it's only $19.99 for a year. And that's a really good app to just help you kind of calm your mind, etc., when you're going through sort of not even a tough time, but just you've always got loads of things on your mind before you're going to sleep. So, you know, there's a great offer on the NHS blue light card app for Calm. So if that's something that you think will help you, if you're someone that's on your phone all the time, then maybe going on the Calm app is going to be better than Instagram or Facebook, etc. Next slide, please. 5 ways to well-being. So something that Pharmacy Support have done a lot of work on is what makes people happy, what keeps people well, and it's around giving. So for me personally, volunteering has been a big part of my life, as I said, for the last few years, and it's really nice when I give something back, because it's those 3 hours at Samaritans that I do each week or more. I don't think about myself. I'm always thinking about the other person, and it takes your mind off of everything that you're going through. Taking notice, so taking notice of people around you, taking notice of the weather's been really nice over the weekend, taking notice of hearing birds in the morning when you wake up. It's just those little things that we just kind of walk through this fog of life and don't take in those little things. Connecting, so connecting with people, and that can be in person, it can be on social media, it can be just making that quick phone call to somebody. Being active, this one, as I said earlier, I think it's one that I find really difficult, but actually I know that when I do something, if I go for a walk or if I use my cross trainer, I definitely do feel better afterwards. At the time it's like, oh, I don't want to do that, but if you do make yourself do something for 10-15 minutes a day, you will definitely feel better after. We're all scientists, we know that you've got endorphins that are released when you exercise, and those endorphins make you feel good. And then learning, as community pharmacists, we're always having to learn new things, learn new skills. But actually that sense of achievement when you eventually do get, and I know some people have got their CPD at the moment, so when you do get that CPD done and you press that submit button, there is that feeling of satisfaction. If you do a CPPE module, or I still like the old books that they used to have when you used to work through them, and you'd be learning something and you feel like you're using your brain. But also what I think when you're learning something, what it does is it takes your mind off of whatever else is going on, because you've got to focus and concentrate on something else. So I think that's always really useful. Next slide, please, Inka. Now, this one, we don't have to actually do this now, and I'm not quite sure if this is the right slide, but it's think about how you might breathe when you're lying on a beach. So this is actually something called box breathing, and it's to practice your box breathing. The reason I don't think it's something you need to think about when you're on a beach, because actually you're probably not stressed if you're on a beach somewhere, and that's not when you need to use box breathing. So I'm going to take this scenario a bit differently. Think about when you're in that busy pharmacy, it's about 2 o'clock in the afternoon, your cup of tea that someone made for you 3 times earlier that day day has gone cold, you've not had a hot cup of tea at all day today, or a hot cup of coffee, you haven't had a chance to have a lunch break, the phone's ringing, the counter assistant's asking you something, there's a patient wanting your attention, and you are trying to check loads of prescriptions, and you just feel like everything is just way too much. And this is where I would really encourage you to say to your team, just going in a consultation room for 2 minutes, or I'm just going to go to the loo, I'll be 2 minutes, and to just stop thinking about everything and just practice some box breathing. So box breathing is where you take a deep breath in for 4, and then you hold it for 4, and you breathe out for 4. So it's just around kind of doing everything in cycles of 4. And just doing that 5 or 6 times will just bring that oxygen back to your brain, and will just kind of just calm you down, so that you feel that you can go back out there and face the pharmacy and face the world again. So it's just breathing in for 4, holding, breathing out for 4, and holding for 4. So just something that you should practice. And actually, you know, the whole thing takes 16 seconds for 1 round. So if you just do a couple of rounds of that, it can take less than 2 minutes. And I think that's really important that we do that. The alternative is you can go to the consultation room, you can go to the loo, and just think about, you know, being on a beach, not worry about the breathing part of it, but just think about, you know, everything that you're doing, how hard you're working. It's hopefully so that you can eventually get that holiday somewhere at some point on the beach. Thank you. There are wellbeing workshops for further tools to manage stress and build resilience. There's a stress management and building resilience workshop, and science behind wellbeing. So pharmacist support can give us some more information. And actually, if anyone ever wants me to run a course, I'm sure I can ask them for the slides, and we can get some pharmacists together. I think they're better done face-to-face, but we know that because of geography, it's hard to get people together face-to-face. So I know during COVID, you know, we were running them online, and I ran one online for LPC colleagues when I worked at an LPC in Kent, and it was the best turnout we had. We had 40 people turn up to this resilience workshop, and it was really interesting that I didn't think people would, because I think as pharmacists, we just get on with it. And, you know, we just think, oh, yeah, I'll do that later. I'll do that later. But actually, I think people were really feeling it during COVID and just needed that connection with other people and something to bring us all together. And I think, unfortunately, stress was something that brought us all together during COVID. And then the final slide is just where you can go to for free and confidential support. So information inquiries, they've got the website, and there's a little bit there around if anybody wants to donate as well to pharmacy support. So that's it from me. Thank you very much, everybody. And I'm happy, Yinka. I don't know what your time's looking like. Happy to do.
No, that's brilliant. Thank you. That was great timing as well. It's 8:31, so I'm not going to keep anyone longer. So you can email me, or you can email David Dean at the LPC any questions that you have after this workshop. Just let me show my appreciations on behalf of myself and everybody here today. Shilpa, thank you for sharing that and your expertise. Really informative. It's just made me really think actually about what do I do for those 5 steps to well-being to keep myself well, and I'm going to have to really kind of think about that. But guys, I hope you found the session useful. The recording and the slides will be made available to you, so we will get that to you, so you've got the information at your fingertips to start putting together your signposting folders to support you have those conversations and signpost appropriately for anyone that you have a conversation within your pharmacy when you're carrying out your NMS antidepressant service. So thank you for logging in, especially during the half term. It's appreciated. We'll stay on with any questions, but other than that, feel free to log off, and I'll get the recording out to you as soon as possible.